So if I could start with CHI and the HSE. So you used a number of various terms to describe the medical personnel that are deployed to the Barnahus centres. So you referred to a doctor, you said variously a consultant, a paediatrician, or a forensic specialist. So I'd like to know precisely, is it a child and adolescent psychiatrist with higher specialist training? And if so, where do they come from? Or what is the nature of the qualifications and higher specialist training of the doctor? You mentioned the nurse, a clinical specialist nurse. What is the nature of their training? And are they a psychiatric nurse? Are they a paediatric nurse? And from what setting? Are they being taken from CAMHS teams to staff the Barnahus model? I just want to know where they're coming from. And I think you also mentioned in your evidence that some of the therapists and counsellors and psychologists were being sourced from outside of the HSE, or are they all? So I'd like to know, are the medical staff and the clinicians, are they full Section 38 HSE employees who have permanent pensionable jobs, or are they being are you getting them from outside the organisation, like for example through Section 39 outfits that provide these services on a kind of on an annual bidding process?
So the HSE and also within the medical side in CHI, all children who come to the Barnahus have the services of a consultant paediatrician who has a special, the SI, special interest in forensic medical services. So they're specifically trained.
No. So when you say a paediatrician,
yes,
what do you mean by that?
A consultant who has trained as a children's doctor, but has an added-on qualification specifically around conducting forensic medical examinations.
And where did they obtain these?
Mostly in the UK.
The reason why I ask this question is because I'm aware with CHI, and I wouldn't see a difference between, CHI are part of the HSE. Is that right?
They're funded by the HSE,
yeah,
Senator, yes.
Okay. So I'm aware that in other areas of the CHI, for example, there are general paediatric surgeons, but they might not have higher specialist training, for example, in urology, or they might not have higher specialist training, let's say, in complex spinal surgery. They're general paediatric surgeons, but they don't have the higher specialist training that's required to deal with some of the very complex cases on the scoliosis waiting list. And, for example, some of those cases are then referred internationally to be dealt with by people who do have the higher specialist training. So my question is specifically related to the paediatric doctor, consultant. Do they have higher specialist training in this area? And when you say forensic, my understanding of forensic is, like for example in forensic psychiatry, that an adult psychiatrist who has a training in forensics deals with offenders, perpetrators, not with the survivors or the targets of such crimes. So I'm just curious to know exactly what do you mean by paediatric specialists, and what courses do they do internationally? Where do they get this higher specialist training? I mean, a special interest is fine, and I commend somebody for having a special interest, but I wouldn't like to be in row 17 of an Airbus that's been flown by a very enthusiastic pilot who's an interest in Airbus, but has never actually done or rate the proper rating. And I know that there is a concern which has been raised here and elsewhere about the HSE appointing doctors to consultant posts who don't have higher specialist training.
Sure. So forensic is used in the context of the examination of children within the Barnahus, or as we currently don't have a Barnahus yet in the East, within CHI, on the basis of being able to gather evidence for the criminal justice process. So the child is examined. If there is any evidence of physical
Yeah,
evidence.
but where did
that can
they
be
get
collected.
this training? Where did they get these qualifications?
So the first element of the training is that someone has to qualify as a paediatrician. So that's the standard medical training that anybody who works within the Irish healthcare service who is eligible to be considered for a consultant appointment has to reach. And then there is an added training that most of the consultants who work in our, in fact, all of the consultants who work in our forensic medical services attain usually through the UK, because we currently don't employ a sufficient number of them to receive their training, that specific training in Ireland. They do, however, as a group of clinicians, undertake regular peer review, particularly in the area of forensic evidence collection, because obviously they must remain competent to be able to undertake that.
So that form of continuing professional development, you know, where you have journal clubs and peer review and people sit around and discuss the literature and the research.
That's not what they do, Senator. What they do is that they look at images that have been taken.
Yeah, no, I'm talking
experience.
Specifically about their qualifications and their higher specialist training. So I appreciate that they're undertaking this work. My concern is around the higher specialist training and whether or not the medical staff and all of the allied clinicians that are there and the therapists, I think you partially answered the question in relation to some of them coming from Tusla. But I think also in your evidence you mentioned, I think was it Carrie, or you mentioned, I think it was a Section 39.
That was Tusla, Senator. But Senator, I don't actually have the information you're looking for. I can't say to you definitively that every one of the consultant paediatricians with a special interest in forensic medicine have
the sense I'm getting from your evidence is that when you refer to forensic specialists, you're talking about people who carry out medical examinations in order to either harvest evidence or to ascertain, you know, any evidence of injury or what have you.
That's right.
In relation to the specialist interviews and the trauma-informed, child-centred interviews that are carried out in the safe place, consistent with the 5 principles that you've set out, is there a psych input there? Are there psychiatrists involved, or is it a psychologist?
I'm going to ask my colleagues in Tusla to answer this.
Specialist interviews are carried out by a social worker, professionally qualified social worker who is specifically trained in specialist interviewing, but they would not be psychologists.
And you don't have any psychiatric input, like child and adolescent psychiatry input at this level? Is there any liaison with CAMHS?
Yeah, there is, but the actual specialist interviewing involves professionally qualified social workers and members of An Garda Síochána working together. But there would often be liaison with CAMHS if the case merited it, or if the child was attending CAMHS. So there would but there wouldn't be a child who is subject to a specialist interview is not necessarily referred to CAMHS by virtue of being subject to the interview, if you know what I mean. But they might have a prior relationship with CAMHS. They may be accessing CAMHS for a service, and then of course CAMHS would be involved in the whole referral, but not in the actual specialist interview.